Good evening. It's 11 across the state of Indiana and across the country. People now are able to sign up to get the booster shot for Pfizer's COVID vaccine. Tonight in our big story, we'll tell you why experts now say getting a booster from a manufacturer different from your vaccine may be more effective. We also look at how close other vaccine makers are to getting their boosters approved. We'll go over the population now approved in the U.S. to get a booster right now. And we also fact check a viral tweet that's making broad claims about who's vaccinated. Then we'll show you how fast the vaccination rate here in the state of Indiana is declining right now. We start tonight with that issue of mixing the manufacturers for the booster shot. Here's insight from a local doctor.
For a while, the rule was simple: don't mix and match vaccines. But that could be changing after a study from the National Institute of Health found the approach to be safe and effective.
This study suggests that perhaps people who've initially received J&J go on to receive a mRNA booster.
Here's how the study worked. More than 450 people volunteered and were separated into groups based on their original vaccine. They were then given one of 3 boosters: Pfizer, Moderna, or Johnson & Johnson. After that, their antibody levels were measured 2 weeks and 4 weeks following their shot. And even though all vaccines gave protection, the data shows people who initially received Johnson & Johnson but got Moderna and Pfizer boosters had a better immune response than sticking with the J&J shot.
We know that it had produced lower immunogenicity, and so this would not be inconsistent with what we've seen previously.
This new research comes as millions already received a Pfizer booster shot since its approval last month. And the extra dose is now outpacing the number of people receiving their first and second shots. For example, here in Indiana, close to 3 times as many Hoosiers received a booster shot in one day compared to those who signed up for their first dose.
This would open the door to the Moderna and the J&J folks to also get that booster.
As the demand for booster shots grow, the potential to mix and match could be a game changer in the fight against COVID. The FDA Advisory Committee plans to review the data on Friday.
Now, as this study waits for FDA approval, there are 2 other manufacturers that have a different request. Moderna and Johnson & Johnson have both submitted for emergency use authorization for their booster shot. A panel of FDA advisors meets tomorrow to review the data on both versions. If the FDA and CDC both sign off, Americans could start getting their boosters later this month. So you might be wondering, who again can get the booster shot? Well, right now the CDC recommends boosters for people who are 65 and older, people 18 and older in long-term care settings, and people 50 to 64 that have been diagnosed with underlying medical conditions. The CDC also says people 18 to 49 with underlying medical conditions and people 18 to 64 with a higher risk because their job may also go get the booster shot now.